It's summertime again, and this is the time for our summer vacations. We have not had vacations for 2 years, for more than 2 years, and this time we are planning to go on a summer vacation. That's good news. So, the time has come for us to talk about the coming summer holidays and what best precautions we can use to make sure that our travel is safe. Did you know there is a new specialist around the block? So we've heard of physicians and cardiologists and ophthalmologists and ENT specialists, but there is now a new specialty in medicine called a travel medicine specialist. And in fact, in certain places in the world now, there are clinics that are opening up which call themselves travel medicine clinics, where they give you advice about what all you need to carry with you, advice about your destination country, your vaccination requirements, and a whole lot of other details depending upon where you are traveling to. So, here is a checklist for us to follow when we are planning for our coming summer vacation. I will divide this into three components: the destination, the preparation, and then during the holiday itself. For the destination, consider a destination where there is a direct flight. More the number of stopovers, the more the protocols you have to follow, and the more complicated it gets and the more time it takes. So try for a destination which has a direct flight from your location. Try to go to a country preferably which is English speaking or understands English, so that if you have a problem, at least you can communicate and you will be understood and you can understand what the health authorities or immigration officials are telling you. It is very difficult if you go to a place where neither English is spoken or understood, because communication in these instances can be very, very difficult. Go to a country which is currently COVID negative. For instance, in the current situation, Shanghai and Beijing are reporting very, very high numbers of virus replication. You do not want to go to places which are currently in the news because of high virus count or because of high caseload. You want to avoid these places. You must go to a country where Indian vaccines are acceptable. Fortunately, the Covishield vaccine is acceptable universally. The Covaxin now, after having received the WHO's emergency use authorization, is also gradually being acceptable in most countries. Make sure your vaccine certificates are available with you. Avoid countries which have very rigid COVID protocols. For instance, in the past, Singapore and Hong Kong had very rigid COVID protocols, and there was a problem to pass through, and at the slightest bit of doubt you were quarantined not just for 5 days or 7 days. In certain instances, quarantine lasted for 3 weeks. So there goes your summer holiday. Make sure you go to countries where COVID protocols are not harsh or not binding in a manner that you may never be able to get out of a quarantine facility. Avoid places which are likely to be very crowded during your holiday period. For instance, I have patients coming in from Paris, and the general news is currently Paris is a very, very crowded place. So avoid places where you think there are going to be large crowds. Try to go to more remote areas where the crowds are less, the chances of catching an infection is less, and where you are likely to be more safe. As far as hotels and stays concerned, prefer resorts which are open air. Prefer rooms where the doors and windows can be opened rather than facilities which are centrally air conditioned and where the same air is being recirculated. If possible, book homestays or self-catering cottages or facilities so that the entire facility is to yourself. You can keep the doors and windows open and generally keep yourself safer than in a crowded hotel. As far as cruises is concerned, my recommendation would be to avoid as far as possible. It's not a complete no-no, but the enclosed spaces of a cruise sometimes can turn out to be a super spreader event, as we have seen in the past. If you can get a balcony suite and if you can largely stay outdoors, it would be a safe option. But if you're not very keen, stay away from cruises for the time being. Now for the preparation. For the preparation, the simplest thing is, first of all, carry hand sanitizers with you. Though the chances of catching an infection by aerosol route is 1000 times more likely than by contact transmission, but just to rule out that small percentage of contact transmission, carry your hand sanitizers. Use them in surfaces where you have to, for instance, the armrest of your aircraft, or sometimes inside a lift where you have to touch common surfaces and you are sometimes wondering whether it could be infected. Those are places you could use. Carry adequate masks with you, depending upon the duration of your holiday. Carry washable masks because these are reusable and you can wash them and use them again. Also, carry N95 masks, particularly in crowded places like airports, airport lounges, and in certain indoor places. Use an N95 mask as far as possible and carry adequate reserve. You must get your booster dose if you have not already taken it. The precautionary dose or booster dose is mandatory and is required by many countries. And make sure you give yourself adequate time between taking the booster dose and your departure, because some countries ask for a minimum 14-day gap between your booster and your travel. RT-PCR test. Though we understand that the RT-PCR test is no longer required for travel, I would still recommend, particularly if you're going on an international holiday, get an RT-PCR test done just before you go. It is just an additional safety feature for you in case you are stopped at some border to say that you are RT-PCR negative. At least it has a validity for a few days, so you will be safe to travel with a negative RT-PCR. If you have recently contracted COVID-19, keep that certification with you, because a recent infection of COVID-19 also acts as a vaccine and permits you to travel to other countries. This is particularly important for international travel because your passport number is linked with your vaccination status, and these can be shown at international borders. Remember, this can only be done in India because the Arogya Setu app may not work in other countries, so do this before you leave. Make sure your vaccination and your booster vaccination certificates along with the QR code are readily available with you so that you can show them at multiple points of entry when you reach your destination country. In this instance, health insurance is extremely important. Make sure when you get your health insurance that it covers you for COVID in your destination country or countries. Also find out whether there is a provision for an attendant to be taken care of, because in case you are in quarantine, you may require the services or you may depend upon your attendant or the partner with whom you have traveled. So find out from the insurance company what all the insurance policy covers. Does it cover for the period of quarantine in which you may have to pay for your stay, as well as for the medication which sometimes you may have to pay for yourself. So make adequate inquiries about your COVID cover before you travel and ask this from the agent through whom you buy your insurance policy. You must read up about your destination country, about the various places that you're going to visit, about various COVID protocols that country follows, and you must adhere to those protocols. In situations, particularly in the current situation of the pandemic, we have to be very, very careful. Carry cash, though most countries have now gone digital, but if you're planning to go to remote areas, it is possible that your cards or your digital payment methods may not work. So keep some cash with you so that it is easy for you to transact. Be flexible. Keep your itinerary flexible. Do not keep it very rigid so that there is enough time for you to play around with your timing. In case there are certain restrictions in certain areas, at least you have a plan B which you can follow so that your holiday is not unduly disturbed. Though this is not technically a medical advice, but keep anti-theft bags, especially if you're going to use a backpack. Make sure the backpack is an anti-theft backpack, which is either a backpack which has a cover entirely over it so that nobody can open your zipper, or where your zippers open towards your backside so that there is no access from outside. Use RFID blocking wallets or RFID blocking card holders so that your digital payment modalities are kept safe. Use tracking devices on yourself as well as on your luggage. There has been an increase in physical as well as digital crime all over the world in the current aftermath of the pandemic, and we need to be a little more careful this time. Avoid traveling alone, because in case you get stuck in a strange country, at least your attendant, traveler, companion or friend can take care of your daily needs and can look after you in case it is required. During the holiday, it is recommended that you avoid crowded indoor spaces. So go to outdoor places like amusement parks rather than crowded museums. So use grocery stores. There are nearby grocery or daily need stores. Buy your beverages, maybe a sandwich, and some food requirement from there which you can eat in an open space. daily needs or a grocery store because they are adequately well stocked with milk, with beverages, and various other fresh items which are available. And these will be safer for you than sitting in a crowded bar or a restaurant. Avoid destination weddings. Destination weddings are turning out to be super spreader events because people come from many countries. A lot of them carry infections, and I have seen, particularly in my clinic, many patients turning positive during destination weddings. Hiring a car or a road trip is a safe way of traveling as long as you make your own travel bubble. Make sure you travel with the same people who are adequately vaccinated and who are RT-PCR or rapid antigen negative. So this travel bubble of yours can travel from place to place, and that is safe for you. You can swim. Swimming is safe, but make sure that you take your bath or a shower in the outside shower outside the swimming pool. Avoid going to changing rooms which are crowded, and indoors. Though not as good as the RT-PCR test, the rapid antigen test is at least an indication to you that you may be infected with the virus. So carry some rapid antigen test kits along with you so that in case required, you can test yourself in your hotel room itself. So go ahead, enjoy your well-deserved summer holiday, but please be careful.